You walk into CVS or Walgreens, maybe Walmart or Kroger, and you head straight for the pharmacy aisle. You're not picking up a prescription, you're grabbing something off the shelf. Something for sleep, something for joint pain, maybe a daily vitamin or a tube of muscle cream. You've been buying the same thing for years, and you trust it because it's sitting right there next to the prescription counter, under bright lights, in a store that feels medical. But here's what a lot of people over 50 don't think about. The pharmacy aisle is still a retail aisle. The products on those shelves are not prescriptions. They are not individually approved by your doctor. Many of them are not reviewed by the FDA before they go on sale. And some of them, the ones with the most reassuring packaging, the most medical-sounding names, the ones that say doctor recommended or clinically studied or #1 pharmacist choice, are the ones that deserve the hardest second look. This video covers 12 pharmacy aisle products that seniors should stop buying on autopilot. We're not telling you to throw everything away. We're telling you to check first. Check the label. Check the dose. Check whether you still need it. Check whether it plays well with your other medications. And check whether there's a smarter option sitting 2 feet away on the same shelf. Some of these products are fine for younger adults but carry real risks for people over 60. Some have changed their formulas quietly. Some are overpriced for what they actually deliver. And a few are banking on your trust in the pharmacy setting to do the selling for them. Let's get into it. #1. Diphenhydramine sleep aids, sold under names like Zizquil, Unisom Sleep Gels, and store-brand Sleep Aid tablets. This is one of the most common things seniors grab when they can't sleep. The packaging is gentle, soft purple, moonlight, a calm-looking person resting peacefully. What's inside is diphenhydramine, the same active ingredient in Benadryl. It's an antihistamine that makes you drowsy, and for decades it's been marketed as a safe, non-habit-forming sleep solution. Here's where it gets serious. The American Geriatric Society has placed diphenhydramine on the Beers Criteria list, which is a widely used guide of medications that are potentially inappropriate for older adults. The concern is real. In seniors, diphenhydramine can cause confusion, dizziness, urinary retention, dry mouth, and next-day grogginess that increases fall risk. There's also been research, including a widely cited study from the University of Washington published in JAMA Internal Medicine, suggesting a possible link between long-term anticholinergic use and increased dementia risk. That research is still being studied, and no one is calling it a definitive cause, but it's enough to make geriatricians cautious. The problem is that these products don't carry any special warning for seniors on the front of the box. You have to read the drug facts panel, and even there, the language is vague. If you're over 60 and using diphenhydramine regularly to sleep, talk to your doctor. There are alternatives, including melatonin at low doses, magnesium glycinate, and even cognitive behavioral therapy for insomnia, which has strong clinical support. Don't let a soft purple box make this decision for you. #2. Extra-strength Tylenol and store-brand acetaminophen in high doses. Acetaminophen is one of the most widely used pain relievers in America, and for good reason. It works. It's easier on the stomach than ibuprofen, and it's in practically every pharmacy aisle in the country. But here's what a lot of seniors don't realize. Acetaminophen is also one of the leading causes of acute liver failure in the United States, and the margin between a therapeutic dose and a dangerous one is narrower than most people think. The maximum recommended daily dose for healthy adults is typically 4,000 milligrams, but many liver specialists and the FDA itself have suggested that older adults, especially those who drink alcohol even occasionally or who have any liver concerns, should stay well below that. Some doctors recommend no more than 2,000 milligrams a day for their older patients. The real danger comes from stacking. Acetaminophen isn't just in Tylenol, it's in NyQuil, Dayquil, Excedrin, Percocet, Vicodin, and dozens of store-brand cold and flu products. If you're taking extra-strength Tylenol twice a day and then grabbing a nighttime cold medicine that also contains acetaminophen, you may be doubling up without knowing it. Before you buy another bottle, read every label of every medication you currently take. Look for the word acetaminophen in the active ingredients. If it appears in more than one product, you need to adjust. This isn't a scare tactic. This is basic pharmacy math that too many people skip. Number 3, daily multivitamins marketed specifically to seniors, like Centrum Silver or One a Day 50+. These are some of the best-selling supplements in America. They sit right at eye level. The packaging says things like complete multivitamin, supports heart health, brain function, eye health, and immunity. It sounds like a daily insurance policy in a tablet. But here's what the research actually shows. For most adults who eat a reasonably varied diet, daily multivitamins have not been shown to reduce the risk of heart disease, cancer, cognitive decline, or overall mortality. A large study published in the Annals of Internal Medicine, along with reviews from the U.S. Preventive Services Task Force, found insufficient evidence to recommend daily multivitamins for disease prevention in the general adult population. That doesn't mean vitamins are useless. Some seniors genuinely need specific supplements, like vitamin D if they're deficient, B12 if they have absorption issues, or calcium if their doctor recommends it. But taking a broad multivitamin as a catch-all is often just an expensive habit that gives you peace of mind without giving you much measurable benefit. And here's the money angle. A year's supply of Centrum Silver at retail price can run $30 to $50. If your doctor hasn't specifically told you to take a multivitamin, that money might be better spent on actual food, like leafy greens, eggs, salmon, and nuts, which deliver nutrients your body absorbs more efficiently. If you do take a multivitamin, check whether it contains iron. Many senior formulas don't, and that's intentional, because excess iron can be harmful for older adults who aren't anemic. But some store-brand versions do include iron, and the label is the only place that tells you. Number 4, glucosamine and chondroitin joint supplements. Walk through any pharmacy aisle, and you'll see an entire section dedicated to joint health. Glucosamine, chondroitin, MSM, turmeric blends, collagen powders. The bottles are big, the prices are high, and the promises are bold. Rebuilds cartilage, supports joint comfort, promotes flexibility. Glucosamine and chondroitin have been studied extensively, and the results are, to put it plainly, disappointing for most people. The GATE trial, one of the largest and most rigorous studies on these supplements funded by the National Institutes of Health, found that glucosamine and chondroitin, alone or together, did not provide significant relief for the overall group of participants with knee osteoarthritis. A subgroup with moderate to severe pain showed some benefit, but the overall findings were not strong. The Arthritis Foundation acknowledges that some people report feeling better on these supplements, and they don't discourage trying them. But they also note that the evidence is mixed, and the supplements are not regulated the way prescription drugs are. What does that mean for you? If you've been taking glucosamine for 6 months and you haven't noticed a clear difference, you might be spending $40 to $60 a month on hope. Talk to your doctor about whether physical therapy, anti-inflammatory strategies, weight management, or even a targeted prescription might serve you better. And if you do want to try a supplement for joint comfort, look for one that has been independently tested by a third party like USP, NSF, or Consumer Lab, so you at least know what's in the bottle, matches what's on the label. Number 5. Nasal decongestant sprays with oxymetazoline like Afrin. Afrin works. That's the problem. When your nose is completely blocked and you spray Afrin, within minutes you can breathe again. It feels like a miracle. But Afrin and similar sprays containing oxymetazoline are meant for short-term use only, typically no more than 3 days. If you use them longer, you risk a condition called rebound congestion, sometimes called rhinitis medicamentosa. Your nasal passages become dependent on the spray. When you stop, the congestion comes back worse than before, which makes you reach for the spray again. It becomes a cycle that can last weeks or months. Seniors are especially vulnerable to this because chronic nasal congestion is more common with age, and the temptation to keep spraying is strong. Some older adults have used Afrin daily for years without realizing the spray itself is now the main cause of their congestion. If you need nasal relief for allergies or sinus issues, talk to your doctor about a nasal corticosteroid spray like Flonase or Nasacort, which works differently and is designed for longer-term use. These don't give you the instant blast of clear breathing that Afrin does, but they address the underlying inflammation without creating dependency. Read the box. If it says, "Do not use for more than 3 days," believe it. Number 6. Store brand arthritis or back pain creams that rely mostly on menthol. You'll see these everywhere. Tubes and jars with names that include words like arthritis formula, maximum strength pain relief, or deep penetrating. The packaging often shows a knee, a shoulder, or a lower back with a glowing red area, implying targeted healing. Flip the tube over. In many cases, the only active ingredient is menthol, sometimes at concentrations as low as 4%. Menthol creates a cooling or warming sensation on the skin. It can feel soothing. But it does not reduce inflammation. It does not repair cartilage. It does not penetrate deep into a joint. What it does is distract your nerve endings temporarily, which is called a counter-irritant effect. That's not worthless, but it's also not what the packaging implies. And some of these creams cost $12 to $18 for a small tube. If you want a topical pain product with more clinical support, look for creams or gels containing diclofenac, which is an actual anti-inflammatory now available over-the-counter under the brand name Voltaren. It has been studied in clinical trials and shown to reduce pain and swelling and osteoarthritis of the knees and hands. It's not for everyone, and you should check with your pharmacist about interactions, but it's doing something that menthol alone cannot do. If you like the cooling sensation of menthol, that's fine. Just don't pay premium prices for a product that's mostly doing what a bag of ice could do. Number 7. Fiber supplements with artificial sweeteners and dyes. Fiber is genuinely important, especially for older adults dealing with constipation, blood sugar management, or cholesterol concerns. So grabbing a fiber supplement sounds like a smart move. But take a close look at the label on some of the most popular options, including flavored versions of Metamucil and store-brand equivalents. Some of these contain aspartame, sucralose, or acesulfame potassium as sweeteners. They may also contain artificial colors like yellow 6 or red 40. For a product you're taking every single day, sometimes twice a day, those additives start to add up. Now, the FDA considers these sweeteners generally recognized as safe, and we're not going to overstate the risk. But some consumers, particularly older adults with sensitive digestive systems, report bloating, gas, or stomach discomfort that they attribute to the sweeteners rather than the fiber itself. If you want fiber without the extras, look for unflavored psyllium husk powder. It's the same active ingredient in Metamucil without the orange flavoring, sweeteners, or colorants. You can mix it into water, juice, or a smoothie. It costs less per serving in most cases, and you control what goes in. Also, if you're taking any prescription medications, check with your pharmacist about timing. Fiber supplements can interfere with the absorption of certain drugs if taken too close together. If you've been watching this far and you've already spotted one product in your medicine cabinet that deserves a second look, drop a comment and tell us which number caught your attention. We read every one. And if this is helping, a like goes a long way toward getting this video in front of more people who need to hear it. Now let's keep going, because the next few are ones almost nobody talks about. Number 8. Calcium supplements in high single doses. Your doctor may have told you to take calcium. That's fine. But how you take it matters more than most people realize. A lot of seniors buy a bottle of calcium carbonate, usually 600 milligrams per tablet, and take 1 or 2 with breakfast, thinking they've covered their daily needs. Here's the issue. Your body can only absorb about 500 milligrams of calcium at a time. If you take a 1,200 milligram dose all at once, a significant portion passes right through you. You're paying for calcium your body never uses. There's also been ongoing discussion in the medical community about whether high-dose calcium supplementation may be associated with cardiovascular risks, particularly in people who are already getting calcium from their diet. A meta-analysis published in the BMJ raised concerns, though the findings have been debated and are not considered settled science. The practical takeaway is simple. If you take calcium, split the dose. Take 1 tablet in the morning and 1 in the evening. Choose calcium citrate if you take acid-reducing medications like omeprazole, because calcium carbonate needs stomach acid to be absorbed properly, and those medications reduce stomach acid. And make sure you're also getting adequate vitamin D, because without it, calcium absorption drops significantly. Don't just grab the biggest bottle at the lowest price. Grab the right form, at the right dose, at the right time. Number 9. Laxatives used as a daily habit, especially stimulant types. Constipation is one of the most common complaints among older adults, and the pharmacy aisle is loaded with solutions. Dulcolax, X-Lax, Senokot, Miralax, store-brand versions of all of them. Many seniors buy these routinely, almost like a grocery staple. But there's a meaningful difference between types of laxatives, and using the wrong kind as a daily habit can make the problem worse over time. Stimulant laxatives, like bisocodyl and senosides, found in Dulcolax and Senokot, work by forcing the muscles of your intestines to contract. Used occasionally, they're effective. Used daily for weeks or months, they can lead to a condition sometimes called lazy bowel, where your colon becomes dependent on the stimulant to function. The medical term is laxative dependency, and it's more common than people think. Osmotic laxatives like Miralax work differently. They draw water into the colon to soften stool. They're generally considered safer for longer-term use, and many gastroenterologists prefer them for older patients. But even Miralax should ideally be used under guidance, not just grabbed off the shelf indefinitely. Before you make any laxative a permanent part of your routine, talk to your doctor. Sometimes constipation in seniors is caused by medications, dehydration, low fiber intake, or reduced physical activity, and addressing the root cause is better than masking it with a nightly pill. Number 10. Eye drops that get the red out, like Original Vicene. Vicene is one of the most recognized brand names in the pharmacy aisle. The original formula contains tetrahydrozoline, which is a vasoconstrictor. It works by shrinking the blood vessels on the surface of your eye, which makes the redness disappear fast. But just like Afrin in your nose, regular use of redness-reducing eye drops can cause rebound redness. When the drops wear off, the blood vessels dilate even more than before, making your eyes look redder, which makes you reach for the drops again. For older adults, this is especially worth knowing because dry eye becomes more common with age, and many people mistake dryness-related redness for something that Vicene can fix. It can't. Vicene Original doesn't add meaningful moisture. It just hides the redness temporarily. If your eyes are consistently dry or red, look for preservative-free artificial tears. Brands like Refresh, Systane, and TheraTears make formulations specifically designed for dry eye. They lubricate the surface without constricting blood vessels. And if you're using eye drops more than a few times a week, see an eye doctor. Chronic redness can be a sign of something that deserves actual treatment, not cosmetic concealment. Number 11. Combination cold and flu medicines when you only have 1 or 2 symptoms. This one catches a lot of people. You've got a cough and a runny nose, so you grab NyQuil or Dayquil or a store-brand multi-symptom cold medicine. The box lists 6 or 7 symptoms it treats. Sounds efficient. But think about what you're actually swallowing. A typical multi-symptom cold medicine might contain acetaminophen, a cough suppressant, a decongestant, and an antihistamine, all in one dose. If you only have a cough, you're still taking a decongestant you don't need, an antihistamine that might make you drowsy or dry-mouthed, and an extra dose of acetaminophen on top of whatever else you're already taking. For seniors, this is more than an inconvenience. Unnecessary antihistamines can cause confusion and urinary retention. Decongestants like pseudoephedrine and phenylephrine can raise blood pressure, and stacking acetaminophen, as we already discussed, can push you toward the danger zone without you realizing it. The smarter approach is to treat only the symptoms you actually have. If you just have a cough, buy a standalone cough suppressant. If you just have congestion, address that on its own. Read the active ingredients on every cold product before you buy it, and cross-check it against your current medications. Your pharmacist can help you do this in about 2 minutes, and it's one of the most underused free services in any drugstore. Number 12. Herbal supplements with vague health claims and no third-party verification. This last one covers a whole category, not a single product. Walk down the supplement section of any pharmacy and you'll see bottles promising prostate support, memory boost, heart health, stress relief, immune defense, and energy enhancement. Many of these are herbal blends containing ingredients like ginkgo biloba, saw palmetto, ashwagandha, elderberry, or turmeric. Some of these herbs have legitimate traditional use and some promising early research. But here's what the packaging won't tell you clearly. Dietary supplements in the United States do not require FDA approval before going to market. The manufacturer is responsible for ensuring safety and accuracy, but the FDA only steps in after problems are reported. That means the bottle on the shelf might not contain what it says it contains, or it might contain contaminants that aren't listed. Independent testing organizations like Consumer Lab, USP, and NSF International have repeatedly found supplements that don't match their labels. Some contain less of the active ingredient than promised. Some contain fillers. A few have even been found to contain prescription drug analogs or heavy metals, though those cases tend to involve products sold online rather than in major pharmacy chains. If you want to take an herbal supplement, that's your choice, and some of them may offer genuine benefit. But at minimum, look for a product that carries a USP-verified mark, an NSF certified for Sport Seal, or has been tested by Consumer Lab. These aren't guarantees of effectiveness, but they do confirm that what's on the label is actually in the bottle, and that the product is free from harmful contaminants. And always tell your doctor and pharmacist about every supplement you take. Herbal products can interact with prescription medications in ways that are well documented but rarely discussed at the checkout counter. St. John's wort, for example, can interfere with blood thinners, birth control, antidepressants, and several other drug classes. Ginkgo biloba may increase bleeding risk. These aren't theoretical concerns. They're in the medical literature. Now let's talk about what you should be doing instead, because this isn't just about avoiding things. It's about making smarter choices with the same money in the same stores on the same shopping trips. First, use your pharmacist. This is the single most underused resource in American healthcare. Pharmacists can review your over-the-counter purchases against your prescription list. They can flag interactions. They can tell you whether a generic is truly identical to a brand name. They can suggest a better form of a supplement. And in most pharmacies, this conversation is free. You don't need an appointment. You just need to ask. Second, when buying any supplement, look for third-party testing seals. USP, NSF, and Consumer Lab are the three most respected. If a product doesn't carry one of these, it doesn't automatically mean it's bad, but it does mean you're trusting the manufacturer's word alone. Third, read the drug facts panel on every OTC medication, every time. Even if you've bought the same product for years. Formulas change, Doses change, inactive ingredients change, companies sometimes quietly swap sweeteners, add new dyes, or adjust concentrations. The front of the box is marketing, the back of the box is information. Fourth, keep a written list of every medication and supplement you take, including doses and timing. Bring it with you to the pharmacy, bring it to every doctor's appointment, and update it every time something changes. This one habit prevents more dangerous interactions than any single product on this list. Fifth, be skeptical of any product that uses the phrase clinically studied without telling you what the study found. Clinically studied can mean that someone ran a study and the results were inconclusive, negative, or only mildly positive. It doesn't mean clinically proven. The difference matters. Sixth, question whether you still need something you started taking years ago. Bodies change, conditions change, medications change. A supplement your doctor recommended 5 years ago might not be necessary anymore, or might even conflict with something you've been prescribed since then. A yearly medication review with your doctor or pharmacist is one of the smartest things a senior can do. And seventh, don't assume that a product is safe or effective just because it's sold in a pharmacy. Pharmacies are retail businesses. They stock what sells. The location of a product next to the prescription counter does not mean it has been vetted by a medical professional. It means it has been placed there by a merchandising team. Let me leave you with this. The pharmacy aisle is full of products designed to make you feel like you're taking care of yourself. And many of them can be helpful in the right situation, at the right dose, for the right person. But right is the key word. What's right for a 30-year-old is not always right for a 65-year-old. What was right for you 5 years ago might not be right for you today. And what looks trustworthy on the shelf still deserves a look at the label. You don't need to be afraid of the pharmacy aisle. You just need to walk through it with your eyes open, your list in your hand, and a willingness to ask one simple question before you buy. Is this still the best choice for me? That question, asked consistently, will save you money, protect your health, and keep you in control of decisions that matter more than most people give them credit for. Thanks for watching. If this helped you, share it with someone you care about, because the person who needs this most is probably someone who's been buying the same products for years and never had anyone suggest they take a second look. We'll see you in the next one.